Body doesn't like that.
So it sends in white blood cells to try to gobble it up like it's an infection, foreign invader. That doesn't get the LDL or the cholesterol out of the wall. All it does is inflame the wall. And this probably starts in our 20s, teens or 20s, we've seen it. As time goes on and this starts to fill up the wall, at first it pushes the wall out. So you'll see lumps and bumps on the outside of the wall. And you may see nothing but normal inside. As time goes on and it can't expand out anymore, then it starts to push the wall in. And so you may lose some of this lumen. What causes most heart attacks is this inflammation in the wall causes the inside wall to rupture. Tears. Now, when I am shaving and I cut myself, why don't I bleed to death? Because I activate the tissue being torn, activates platelets in my blood, little platelets, which then get sticky and form a blood clot in there. Well, the same thing happens inside our arteries. When this inner wall tears or ruptures or becomes ulcerated, platelets are activated and you form a blood clot in there. And that's what causes most heart attacks. You may have some degree of narrowing, but the artery wall tears, rips, ulcerates, and you get blood clots activated. So what happened from 3 weeks ago where I feel fine, I'm doing great, to oops, I don't feel so good, is you either tore the artery, which is very common when they're sick, and then activated some platelets and got a blood clot there.
So it's just because of the amount of time it just decided. I mean, there's not one thing he did. It just ruptured then.
Oftentimes not just one thing we did. It's a lifetime of what we eat and lifestyle and the buildup, and then until finally the straw that is on the camel's back causes a rupture and blood clots, and then it closes the artery.
So it wasn't like a piece of plaque that floated in there and just all of a sudden blocked it.
It's interesting you asked that. It's a really good question because there is no plaque that breaks off because it's under the wall.
Because it's all in those layers.
It's in the wall and it's just literally compressing it. So if this is the artery and I squeeze it in, what's going to break off there?
Yeah.
Nothing. That's really what's happening is that this influence in the wall itself is squeezing it in. And you can have stable angina, meaning I'm walking along getting tightness, which means the artery's narrowed enough where I can't get blood through there to supply the demand that I have for blood when I'm walking. It can't be supplied because it's too narrowed. And it may go away when I stop walking. That's stable exertional angina, as opposed to unstable angina, which is oftentimes a heart attack, where it's not only perhaps narrowed, but there's a blood clot or some spasm in the wall too, which is really limiting flow for that time period.
The thing I guess I keep thinking is that trying to pretend I'm perfect, but I don't fall in those categories. I mean, I smoked a little bit in graduate school, but that was a lot of years ago. I worked out, usually about 5 days a week in the morning. I used to run until my knees were not such that I should, so I've gone to a stationary bike, but for the most part, for
low cholesterol.
You've had a healthy
50
lifestyle.
years,
Low
since college, I've done that. My cholesterol's low. Blood pressure's always been, quite
Tell me about your parents.
acceptable. My mother died at 92, and died of, I guess,
Congestive heart.
congestive heart
But
failure.
certainly didn't have premature
No.
heart problems.
And my dad never had any heart problems. He died of pancreatic cancer at 78.
I didn't look to see what your good cholesterol was, your HDL. Was that normal?
Usually good.
Yeah, it's always been good. So
Yeah.
I mean, it's not that I led a perfect life. But I mean,
A
maybe
charmed life. for
a
52
lucky
years.
life. For 52. But I mean, from a standpoint of alcohol, I never abused that. I maybe have a glass of wine once or twice a week, or not even that.
So you're thinking that it all the
But I'm
good
trying to
things you
figure out
did.
all these things that are supposedly
But I don't think it's what you.
I think
necessarily-
that would cause it.
The fellow
right
that
there.
did the procedure, we talked to him a little bit downstairs and probably asked him that question a little bit in a different way. And he just said, you're 78 too. He's a man and he's 78.
We've been looking for a gene, since we all have genes. We've been looking for a gene that we can call the heart attack gene or the heart disease gene. We know that parents can pass on high cholesterol and high blood pressure and being overweight and all these different things to us. Yet we've been looking for that gene that doesn't include any of those, but just gives you a heart attack. We haven't found it yet, but we'll continue to look. Oftentimes our answer is a shrug of the shoulders and saying, well, obviously your cholesterol was too high for you.
Yeah, that's what he did say that downstairs.
But it's hard to go through life and worry about risk when everything is where it's supposed to be according to the doctors and the studies, and then you wind up in the hospital. So, not at all fair.
Well, I'm just kind of trying to think, well,
What did I do better?
what can I do so I don't have this reoccur? Is the type of thing.
Keep doing what you're doing, probably.
Well, we're going to have you on medications, we think, to lower your cholesterol further. Remember we talked about the eventual cause of a heart attack oftentimes is the rupture of the inner wall and then blood clots forming? Well, the blood clots we treat with antiplatelet agents. To begin with, you're on 2 of them, aspirin and then another one, either Plavix, Brilinta, whatever they put you on, because the stent that they put in is prone to causing blood clots to form on the metal. And that stent, in the old days, the first stents that we used would get covered up with scar tissue pretty quickly. Well, now they have drug on the stent, so it doesn't, almost never get scar on it. When we used to do balloon angioplasties and we'd widen out the channel and we'd rip up the artery with our balloon and whatnot, probably 40% of the time we'd have re-narrowing in 6 months to a year. We'd expand the wall, and because of the muscular layer, you'd have elastic recoil, and we'd rough it up so you get scar tissue growing in, and it just looked like a bomb went off in there. We started with stents back in 1994, and you'd get no elastic recoil, but there was a reaction to the metal by the inside wall that would be intense scar formation. Wouldn't collapse the stent, but it would grow in and around, and you'd get narrowing from that. Probably in 20% of the time you'd re-narrow in the first year. Now the re-narrowing rate is 3%.
That's good.
And that occurs because the drug on these stents that slowly comes off, it prevents scar tissue. But if you don't have scar tissue, that means you have metal sitting here, and what protects from platelets catching on that and making a blood clot? And that's the antiplatelet agents that we use.
That he'll take forever.
The aspirin forever, and the other ones for a year.
Oh, that's right.
And then the cholesterol medicines, the statins that we use. Had you been on a statin before? It's interesting. Everyone thinks that the statins are used to lower cholesterol. Now, they do that. It's fabulous. They do that. But that's not why we use them. Why do we use them? There is an effect on the artery wall by statins that really none of the other cholesterol medicines other than statins have, where they diminish the amount of inflammation in the wall so it's less likely to tear, and they thicken up the wall so it's less likely to tear. So it reduces your risk of a heart attack just by taking them, no matter what your cholesterol is, by close to 30%, 25 to 30%. If you add aspirin to that, which reduces your risk of a heart attack or stroke by 30%, you've reduced your risk by 60% by taking 2 medicines.
Pretty easy.
So that's at least a way to start. And then then no more Mr. Nice Guy. Then we start working on diet and exercise, making sure that you're doing all of that.
That's
I
good.
guess I could learn to like fish.
We'll try.
You know, there was an article last week you may have read, and it was everywhere on the news about meat,
Yeah.
processed meat.
Yeah,
And,
yeah.
And it wasn't anything we haven't known for 30 years. It just keeps rearing its head and saying these things to us again. In America, for whatever reason, we have our culture, and we really don't change very much. What most everybody did in the 1940s and 50s, everybody still does. And unfortunately, it causes heart attacks. So we are trying to beat the drum a little bit more about things that we know and things that you can do, that you can eat happily, but stay thin and exercise and live forever. So that's the goal.
Yeah.
What did you do before you retired?
Banking.
Banking?
Yeah, so,
No stress in that.
No,
for
never.
the last few years.
I'll bet.
It wasn't as I was out abusing myself physically, so I did go work out, so trying to
And-
do that.
Well, Mom has had ovarian cancer for 16 months, so that's been a slight
That's a
stress
too.
at home.
Sure. You look marvelous.
Thank
Doesn't
you.
she?
Still on treatment, yeah.
Wow.
A lot easier. This is a once a month rather than the,
More
the
more
first
intense to
the
begin with.
first one was
Oh.
hard, yeah.
Well, you look
Tough.
really good.
Thank you.
Dr. Erdahl was Jim
Yeah.
Erdahl.
Yeah, she had
Is that who takes care of you?
no,
No,
she had
it
blood
was-
I
clots.
was in the same
with
room here.
chemo.
So that's how we met him. Was
10 days I was
In the
here.
lungs?
Yeah.
A young woman, 36 years old, daughter of one of our close friends, was short of breath yesterday, and was taken to the emergency room and had pulmonary emboli as well.
Mhm. Did she have cancer? or
Well,
chemo?
it's funny you ask that. My wife, who's biggest worry ward I know in my life, worries about everybody and everything. Says, how could that be? She's so healthy, blah, blah, blah. I said, well, it can occur after pregnancy. It can occur because you hit your leg on something and you abuse a vein. I said, but it can occur with ovarian and other types of pelvic cancer too. I said, so she's going to have to be evaluated a little bit.
That wasn't the good part. None of
No.
it was good, but that was the
They put in one of the
what do you,
looked like a hook.
filters,
Yeah.
filters, and
Yeah.
2 ports and going all full force. It'll
It's
go.
not been the most relaxing last 2 years of their
No, it
lives.
sounds like not. On the other hand, with what you have, you can live happily ever after.
Thank you.
I'm blessed from that standpoint. Family, 52 years of marriage so far, so
Wonderful.
I think it'll stick.
Yeah. Well, we got to keep you healthy too.
Yes, we do.
You have a joint venture going on here.
Yes, we do.
That's true. 9 grandkids to tell what to do, right?
I think their grandparents are pretty cool.
I don't blame them a bit. Can I take a listen to you while you're laying here? They closed your groin where they punctured it, so that's good.